Welcome to the InTouch Health webinar series. This is Rachel Gonzalez, and I'll be your host for the webinar. Today, we're featuring Andre Grujovski and Gary Douville of InTouch Health, and they will be presenting on InTouch Health's newest virtual care device, the InTouch Lite 4. Andre Grujovski is the VP of Solutions and Product Marketing at InTouch Health. He has worked at InTouch since 2005 and has served in a variety of roles, including account management, product management, marketing management, and marketing leadership. Andre received his BSE from the University of Michigan and his MBA from Pepperdine University. Gary Douville is the EVP of Connected Devices and Operations at InTouch Health, and he has 20 years of experience in engineering, product development, operations, and Six Sigma quality. He was recently Vice President Operations for Channel Technologies Group, a portfolio of private equity-held companies. Prior to this role, he was the General Manager of Textron Systems, Goleta Operations, where he led the organization through a significant growth period. He began his career at General Electric, where he was a design engineer, program manager, Six Sigma Black Belt, and program director. Mr. Douville earned his BS in Mechanical Engineering from the University of Connecticut and an MS in Management of Technology and Innovation from Rensselaer Polytechnic Institute. He is also a graduate of the General Electric Technical Leadership Program and the author of 10 patents. We'll begin our webinar shortly, but first some notices. You all have been auto-muted. If not, please make sure you mute yourself. At the bottom of your console are multiple application widgets you may use. If you have any technical difficulty, please click on the Help widget. It has a question mark icon and covers common technical issues. You may expand the slide area by clicking on the Maximize icon on the top right of the slide area or by dragging the bottom right corner of the slide area. During the webinar, you'll be able to enter questions in the Q&A widget located on your audience console. Questions will be answered at the conclusion of the presentation, so please feel free to ask your questions at any point throughout the webinar. If a fuller answer is needed or we run out of time, questions will be answered later via email. This webinar will be recorded and a copy will be available on our web via email about 48 hours after the webinar concludes. And then lastly, this presentation should last about 20 to 25 minutes, including time for question and answer. And now without further ado, here are Gary and Andre.
Thanks, Rachel. So this is Andre. I'm going to start it out. And just to give everybody a quick overview, what we're going to do is we're going to tell you a little bit about the evolution of the Lite product that many of you are familiar with, and then go into some details around the Lite 4 itself, some of its new capabilities that it offers, and talk about some of the supportive material we have that you can get access to learn more about it after the webinar, and then tell you a little bit about how you might be able to access the product and take a little look for yourself. So the first thing that we're going to talk about is a little bit of the rationale behind how we brought the Lite 4 to market. So the Lite 4 is available today. It's really the main version of our Lite that is existing. It's Lite 4 because we've had 3 versions of it before. And really what we wanted to do was completely redesign and engineer the device for acute care. We've created a more compact, maneuverable design, which weighs less than its predecessor. We've added in an intuitive touch screen that delivers an easy-to-use experience. And really, this touch screen creates a new platform where additional software capabilities can be offered. It now has dual high-definition cameras for both wide-angle views and when you're zooming in for a detailed examination. It has enhanced peripheral integrations for real-time streaming of valuable medical data from live auscultation and high-definition medical imaging equipment. So now you can still feel comfortable. You can feed all of those medical peripherals into the device and stream them to the other side. We're offering an HD boom camera in an upcoming version, which we'll mention at the end of the webinar. And it still maintains our industry-leading connectivity and 24/7 proactive monitoring to ensure successful telehealth connections. It's on our network. It functions just like our other products. The user from the provider side still has all of those same great controls that they're familiar with, like our patented box zoom and other great capabilities. Another great enhancement we've made is a single deep cycle battery that really is designed for use in healthcare systems. And now Gary is going to tell us a little bit more about the Lite 4's features and capabilities, starting with the evolution of the product design.
Thanks, Andre, and thanks, Rachel. Good morning, everyone. So the InTouch Lite has been one of our most successful products for our customers and has been in the field for over a decade. You, our customers, have clinically used our Lite V1, V2, or V3 in the month of October alone clinically in over 22,000 sessions and life to date in over 750,000 clinical sessions since the inception of the Lite V1 10 years ago. Since this product continues to be so clinically viable and valuable to our customers, we've made significant improvements to the latest generation, the InTouch Lite 4, which we are delighted to introduce to you today. So here it is. We have completely redesigned the Lite 4 from the ground up. We have designed in an integrated peripherals compartment for storage of your valuable medical peripheral devices. Also, a configurable port panel comes standard with USB 3.0, HDMI out, and Ethernet, while HDMI in, video in is an option that can be added at the time of purchase if your use cases require it. As Andre mentioned, we have redesigned our battery system to be a single deep cycle battery that will enable 4 hours of in-session use when left unplugged. The battery life and reliability will greatly exceed that of legacy systems due to the deep cycle capability that will better withstand deep charge abuse. The new head design incorporates a 4-speaker system, dual HD camera system with wide angle and 24x effective zoom, an integrated touchscreen, as well as a future option for thermal camera, which offers remote providers an adjunctive tool to view, measure, and record heat patterns and trends. This thermal camera will be launched later and is an optional accessory and will be released as soon as the FDA 510K submission is complete. This is targeted for Q2 of next year, if not sooner. The user interface enabled by the touchscreen allows you to interface with the device in completely new ways. After tapping touch to start, you can access the camera system's out of session, which is not a feature available today. You can access the product user manuals. You can check your network settings. You can adjust your volume, etc. Additionally, and this is something that we are very excited about, a web app can be embedded to access any URL for things like EHR, documentation, and other workflow applications, including the soon-to-be-released InTouch Consult Request app. Lastly, in session, an immersive experience will enable many of the same controls that you are accustomed to in our provider access software, such as picture-in-picture configuration, volume adjustment, muting microphone and video, and many other features. With that, I will hand the controls back over to Andre to take it from here.
Thanks, Gary. So there's a lot of exciting new enhancements to the Lite 4, and with that, we wanted to make sure we capture that in some nice collateral that can be accessed. And actually, for those of you here on the live webinar, you have access to those materials in your resources. And so the first one is a brochure overview of the Lite 4, which really talks about a lot of the things that we've gone through in this webinar so far today. It'll show you some of the key design features, all of the core capabilities and functionality about the product. The second element is what we call our Lite 3 versus Lite 4 comparison, or side-by-side. And this really walks you through from the last iteration of the product to the current version, to give you a little bit of a comparison between how things have advanced and how they've evolved between what you might have as a current existing customer to what you might be looking for in the future. And then finally, we have a deep technical specifications guide that goes into all of the nitty-gritty around how the product is designed, battery technical details around power consumption, etc. And that's something that we're able to provide as necessary, and along with a frequently answered questions guide that might answer some more questions beyond just what you might find in the brochures. And so with that, we'd like to move to question and answer around our Lite 4. Two of the things we did want to mention were, one, you see here that there's a Lite 4 boom camera that's noted here. That is another product that we're going to be introducing in the first quarter of next year, and that product will be essentially what you see in the Lite 4 with an extensible boom arm. We'll let you know when that product's available as well and communicate that to you regularly. And finally, for those of you that are familiar with our provider access software, it's the piece of software that runs on your computer that allows you to connect into our various devices and care locations. You now have the ability to connect into one of the Lite 4s that's located in our Innovation Center. So if you want to jump on and take a look and see what that experience looks like just for you, I think I'd point out that one of the great things is you're going to maintain a similar experience that you're used to in the past. So you're going to already know right where the controls are at, how to do things, and that's really one of the things that we want to maintain throughout our product line. Make sure that user experience and adoption is really easy. And so with that, we'll move to question and answers, and Rachel, if you'd like to take it away.
Yeah, so please make sure you get your questions in through the Q&A widget located on your console. And it looks like we have a question here. When will consult request be available?
Hey, so that's a great question, and I'll take that. This is Andre. The consult request functionality is actually rolling out through a phased approach. The first phase of our consult request functionality is actually almost available, and we're going to be doing a separate go-to-market webinar with that soon. Those capabilities are really designed for low acuity care. And the reason for that is that when you move into high acuity care, there are some more stringent capabilities around consult requests. You have to ensure that there are responses being sent back to the patient side, letting the staff know that where you are in the process, that the staff waiting on the patient side isn't just sort of left wondering what's happening. And so we're going to have the emergent capabilities ready in the first half of 2019, and we're targeting for an end of Q1 availability for emergent consult request capabilities. And we'll definitely be providing you with a webinar about consult request and the capabilities that it's going to enable. And so I probably should have just started off that question for those that aren't aware. Gary talked about the web app interface on the Lite 4 and what that starts to enable for us. And consult request is a capability that allows you to, using a touch screen or even a web app or just a web browser, to be able to go in and select a service and say, I would like a consult request for this type of service, perhaps a stroke consultation or a cardiology consultation, etc. And then that request goes into our system and can match it up with provider availabilities, send out alerts to those providers, and allow them to connect back in, and really improves efficiencies and offers and workflow capabilities for our customers. And so we know there's a lot of excitement around that as we've introduced that earlier in the year for those of you that attended our July Innovation Forum. And we're moving ahead rapidly with that, and we'll provide you more updates in the near future.
Great. It looks like another question is, what are the key use cases for the Lite 4?
Yeah, so this is Gary. So the standard Lite 4 is currently being used. We have over 1,000 of these Lite 1s, 2s, or 3s deployed. Most of the programs or use cases today are around stroke, but there are many additional use cases such as neonatology and other acute type use cases in the ED settings in hospitals. So I would say from a statistics standpoint, 80% of the lights are being used on a session basis for telestroke, and then the remaining 20% would be for neonatology, ICU, and a smattering of other emergent use cases.
Yeah, and I think just to take off on the end there, you know, we've found the most success, our customers have found the most success with the Lite product and the Lite, and now looking at the Lite 4 in the emergency departments. Right? With stroke as sort of a flagship starting use case with its proven model, and then layering on additional services like behavioral health or other types of emergency medicine.
Yeah, and a few of the features that really make it uniquely positioned for that environment, which, as you know, is can be chaotic and very loud, is we have a very robust speaker system. So audio is incredibly powerful on this device, and we continue to invest in both audio and video from generation to generation. There's also an omnidirectional microphone that is incredible that's integrated into that movable head. And so that device in that environment with the ability to rotate and move the head offers an incredible user experience in even the toughest and loudest and most chaotic situations. One last point on use cases is the Lite 4 with Boom Arm, which we are launching in January, as Andre alluded to in Q1, and actually we're on track for early January. That is being optimized for the teleneonatology use case in the NICU to enable a neonatologist to interact with the baby, with the local care team, and with the peripherals and diagnostic data as part of a Panda draft in the NICU in a very integrated manner. And so time is of essence, in particular in that use case, and having eyes on care team, baby, and data concurrently is what we're optimizing around for that device.
Great. So it looks like those are all the questions we've received. We'd like to give a big thank you to both Andre and Gary for today's presentation. If you have any questions or would like more information, please contact us at feedback@intouchhealth.com. And with that, we'll conclude today's webinar. Thank you for attending and have a great day.